When behavioral interventions are not enough to address the behavioral difficulties in an individual with Angelman syndrome, sometimes psychotropic medications will be considered. Unfortunately, to date, there have been no randomized placebo-controlled trials of these kinds of medications in individuals with Angelman syndrome. The information that I'm going to discuss today is drawn more from research done in disorders such as autism and Fragile X syndrome. It's also drawn from the clinical experience we've had with treating individuals with Angelman syndrome. Psychotropic medications are often prescribed by psychiatrists, and these medications act on the central nervous system or brain to influence mood and behavior. These kinds of medications include antipsychotics, antidepressants, stimulant medications, among others. Individuals with Angelman syndrome, in our experience, are more sensitive to psychotropic medications than typically developing individuals. This means that they may suffer side effects at a lower dose than those experienced by typical individuals. Our recommendation is always to start with very low doses of medications and titrate up slowly until the desired effect is achieved. It is most helpful to work closely with a psychiatrist who can monitor for the development of adverse effects as well as watch closely for changes in mood and behavior. Anxiety in Angelman syndrome is a common symptom and can be treated with relatively safe medications. The first-line medications for anxiety symptoms are selective serotonin reuptake inhibitors. This includes medications such as Prozac, Zoloft, and Celexa. These medications can be very beneficial for the treatment of anxiety. However, they do carry the risk of adverse effects. Some individuals with developmental disabilities, and individuals with Angelman syndrome in particular, can be at risk of behavioral disinhibition with these medications. By this we mean the increase in irritability or disruptive behavior. For individuals wishing to be treated for anxiety with a selective serotonin reuptake inhibitor, we recommend starting at a very low dose and monitoring closely for the development of increased irritability. Should the individual do well on the medication without adverse effects, these medicines can often be very beneficial for treatment of anxiety. As second-line medications, we use alpha-2 agonists, such as Tenex or Clonidine. These medications are medicines used at times to treat blood pressure. However, they often have a calming or sedating effect. These medicines at low doses can often relieve anxiety in individuals with developmental disabilities. Because of their effects on the body as blood pressure medicines, we often have to monitor closely to make sure the individual doesn't suffer a decrease in blood pressure while taking these medicines. Third-line treatment may include the use of a medicine called Buspar or Buspirone. This is a medicine used to treat anxiety and can often have beneficial effects if selective serotonin reuptake inhibitors or alpha-2 agonists are not beneficial. We recommend avoiding the use of benzodiazepines such as Valium, Ativan, or Xanax in individuals with developmental disabilities. These medications can often cause behavioral disinhibition, cognitive dulling, sedation, and at times can be habit-forming. They are not first-line treatment for anxiety in individuals with developmental disabilities. Treatment of major depression in individuals with Angelman syndrome is very similar to treatment of depression in individuals without developmental disabilities. Again, first-line treatment for symptoms of depression includes selective serotonin reuptake inhibitors such as Zoloft, Prozac, or Celexa. These medicines are FDA approved to treat depression and often can be very beneficial. Again, we have to monitor closely for the presence of adverse effects, but often these medicines used at low doses can help greatly with symptoms of depression. Should one of these medications not be beneficial, second-line treatment includes the use of selective norepinephrine reuptake inhibitors. These medicines include Effexor and Cymbalta. These medicines, again, are often useful for the treatment of depression symptoms and have a low risk of adverse effects. Treatment of ADHD symptoms in individuals with Angelman syndrome can often be quite effective to help reducing the level of hyperactivity and impulsivity. First-line treatment, again, are alpha-2 agonists, such as Tenex or Clonidine. These medications are old blood pressure medicines, but have a calming effect that can really be helpful in individuals with hyperactivity and impulsivity. Again, these medications have the potential to lower blood pressure, so monitoring of blood pressure while the individual takes these medicines is important. It's also important to start at a low dose and titrate up slowly. Stimulant medications such as Ritalin or methylphenidate should be used cautiously in individuals with Angelman syndrome, and developmental disabilities in general. These medications can be helpful for the treatment of ADHD-like symptoms. However, they do have the increased risk of causing irritability and aggressive behavior. If trying a stimulant medication for the treatment of hyperactivity and inattention in an individual with Angelman syndrome, we recommend starting at a very low dose and titrating up slowly. These medications can have benefit, however, must be monitored closely for the presence of adverse effects. Third-line treatment for the symptoms of hyperactivity and inattention in individuals with Angelman syndrome is a drug called atomoxetine or Strattera. This medicine can be helpful for treatment of these symptoms, however, it has been associated with changes in mood and behavior. If trying atomoxetine or Strattera for symptoms of hyperactivity, again, we recommend starting at a low dose and monitoring closely for the development of adverse effects.